One, two, and three. Hello everyone, Dr. Rich Castellano here, the Smile Doctor. We are here at the FFAS meeting in New Orleans with Dr. Seth Yellen. Thank you so much for doing our interview. How are you enjoying the meeting so far?
Well, first of all, thanks for interviewing me, Rich.
My
Appreciate
pleasure.
it. The meeting's been great. One of the best things about going to meetings is getting re-energized, right? So you're meeting all your colleagues and your friends, and everyone thinks thoughtfully about problems that really very few people in the world think about, right? So it's a unique opportunity to pick other people's brains. I think I learned as much in the hallway as I do in the lecture hall. And, you know, it's always fun to come back and be re-energized and energize your staff. So it's been a great meeting.
So, and just to give viewers a perspective on that, so when we go into the lectures, doctors are talking and there may be a little bit of a discussion there, but when you leave that and then you're talking with another colleague, it's a whole nother level, and that's a wonderful part of the artistry of what we do to keep up with the changing technology, the changing trends, the change in our experience level, the abilities that we have. So I'm curious, what's popular in your office nowadays? What are patients really choosing for their treatments in your office?
Sure. Well, I'm part of a large dermatology practice. I'm a facial plastic surgeon. I'm a bit of an oddball in this very large, well-established practice. And I find that there's been a shift. When I was academic, I was chief of facial plastic surgery at Emory for about 13 years. And I tended to be much more surgically focused. And really fillers were not a footnote, but they were not a dominant portion of the practice. And I think there's been a real trend towards non-surgical interventions. I think people are looking for that. They're coming and asking me for that. Sometimes I wonder if it's the fact that they're seeing dermatologists, and that's a lower bar than seeing the plastic surgeon.
Yep.
And they're being referred to us for treatments. But, you know, I don't think it's just that, because the internal referral aspect of our practice is only about 20% of my patients. So it really is a trend that I think is just occurring just organically in the community. And as a result, I've really mastered the techniques of three-dimensional revolumization and resculpting with injectable fillers and Botox. So that's certainly a trend. The other trend is, again, from the Mohs surgeon, seeing what they can do under local anesthesia and how they push the envelope. It just empowered me, right? So I do so much more in the office surgically with just 1 milligram of Xanax, plus minus a little narcotic, a little hydrocodone, and an oral antibiotic. So I think, you know, I bring patients to the OR only when I absolutely have to. And to me, that is still, if I'm doing a facelift and eyes and multiple procedures that, you know, it's a 5, 6, 7 hour procedure, that's going to go to the operating room. That's too much for the office. If I'm doing a rhinoplasty, I could do some small things in the office, but if I'm doing a complete rhinoplasty with osteotomies, then I'm taking them to the operating room.
Hard to do osteotomies under local, but not impossible.
No, I worked with a master, right? So I trained with Norman Pastoric in New York, right? And
I'll never forget the videos where the patient's awake and talking, blinking their eyes, and he's doing the osteotomies, which the osteotomy is breaking of the bone, which is necessary for some nasal surgeries.
Sure.
And you have to be very skilled to do that under local while the patient is awake.
Yeah, but one thing that Dr. Pastoric does is he gives them a cocktail injection. So, you know, they have multiple medicines that are a bit stronger than what we're normally going to use orally, and they are in a monitored environment in the hospital, but it is masterful. I'm not going to argue.
Amazing.
So, you know, we create the right environment with the right music, no extraneous talking, creating a very zen-like environment, puts the people at ease. They also get to know my staff before the procedure, so I think it's all about maintaining the big picture and keeping people comfortable and confident in your skills.
The experience is very important.
Absolutely. It is all about the experience. You know, we work on faces, but we affect what's inside the head, and we treat faces, but we really treat the whole patient.
Look good, feel good, do good.
Yeah, that's it. That's as simple and complete as you can state it.
I love it. And there's so much in what you just said. I appreciate you sharing that. And I can still remember as a surgeon that day when patients are asking for fillers, and in my mind I'm like, I really don't want to do fillers.
Yeah.
I'm a surgeon.
Right.
I don't
Right.
have to. And then you just say, fine, I'll do it. And now it's 50% of my practice. And I came to the humble observation and conclusion that nobody really wants to have surgery anyways. I don't want to have surgery. But if you need it, you really want, it's good to have that option. But patients are choosing other things first. And when you look at the data, people are not having less cosmetic surgery. They're in fact having more, but they're doing a lot more of the minimally invasive and non-invasive. So wonderful, thank you for sharing that. Now I'm curious also, how do you like to set patient expectations? Because it can be so difficult with the information out there and they go see Dr. Google before they see us and we have to deal with that. How do you like to set patient expectations?
Well, first of all, I never forget that a major surgical operation is any surgery on me. So I keep that in mind, right? So I know that people come in anxious, right? They're anxious about it, and they're anxious seeing us. You know, we're not intimidating, but you know, people are a little bit stressed out when they're coming to see you, right? So I think the first thing to do is to schedule enough time to give them a good understanding of their issues and how you're going to fix them, and it should be a conversation. Right? Aesthetics ultimately is about taste, and making sure that your taste and the patient's taste are in alignment is really, really important. So that's number one. Number two is listening. You know, doctors tend to ask questions and do a lot of talking, but not a lot of listening. So I think you have to listen to the patient.
It is very difficult to be a very good listener.
Stop talking. Okay, I'm just joking.
I know, that's true. I stopped listening to say that. It is hard to be a really good listener, so go ahead, please.
I was just joking about it because you know, the truth is that, no, I mean, the fact is that, you know, we're already in 5 seconds in our mind going through the list of things that we want to tell them.
So true.
And a lot of what we have to say is really about creating at least some common knowledge so that when I suggest something, they understand what I'm talking about.
Yes.
So I start by talking in generalities and I tell them how I think about facial aging, which is basically laxity from gravity, which typically needs some surgical correction.
Yes.
Rhytodosis, loss of elasticity, dyschromia from sun damage, which typically needs some type of skin treatment, whether it be non-ablative or ablative lasers or BBL or peels or home skincare, things like that. And then volume loss and volume redistribution with age, which in my practice today is fixed with injectable fillers. So that gives us at least some common basis for discussion, and then we go through the issues that they have. I always start by addressing the concerns that they have. And then I ask permission to see if they're willing to hear other things that I can suggest that may help them, help them look better. You know, you don't want to knock someone's confidence down when they're coming to see you, and they leave. They should feel like it was a good educational experience, but they shouldn't feel sad.
A lot of patients may leave a consult and now be more upset. They say, well, I wasn't thinking about this other thing, and they brought it up.
Right.
So you're very thoughtful to...
Yeah. Right. So, you know, you have to just be very delicate in how you raise issues. And that extends even to things like hair and makeup, which I do get into. So it makes our work look better. If someone, dresses very beautifully and is very well put together, you know that your work is going to look that much better on that individual. So anyway, it's really spending the time up front to make sure that you're being heard, that you're listening to them, that they understand what you say, that you understand what they say. It's really about just a good conversation.
Yeah. That
is the basis for the doctor-patient relationship. And everything that happens and flows from there is that much easier.
Yes.
And, if a doctor says that he gets no complications, never, he's either lying or he's not busy, right? So that doesn't mean that they're common, but there's always a risk, and people never think it's them. But if there's a problem after surgery or a problem after a filler, if they trust you and they believe that you're being honest with them, it's a much easier problem to manage.
Yes.
So, we don't have a large complication rate, but it's the outliers. It's the people, it's that one patient that you see on your schedule that is either unhappy or had some issue, and how you deal with that defines your practice.
Yes.
It's like the others are expected. They're chip shots. They're gimmies. People are happy. You're injecting. You're operating. People are happy. They're loving you. That's the easy day. The hard day is when that one patient comes in who's not happy. How do you manage that? And how do you make them feel? And how does that resolve? That defines a good doctor-patient relationship.
I love it. It's so many things to comment on what you said. It's all about the communication. You know, communication is not what we say, it's the response we receive. So as you said, the back and forth. And one of the things, of course, that I like to do is when we have the unhappy patients, the best way to treat them is preventative, because as we've talked about before, if we can't get a patient to smile through the entire consultation, what's the likelihood they're going to smile after we do our very best work?
Yeah.
It's pretty low. And I used to try and treat those patients, say, well, I'm good, I can make them happy. And now I screen those patients out, which makes it so much easier to deal with, because when you have high smiling patients, if they have a frustration, which as you said can happen, now they're more willing to work with you. But the ones that are low smilers to begin with, they just wear the team down, they wear the doctor down, and so it's all about setting that expectation. So this is wonderful. This is high-level information on how to get good results, because people are getting not great results in cosmetic procedures all the time. So this type of expertise is very valuable. So thank you for sharing that.
Sure.
Where can people find out more about you and your practice, Dr. Yap?
Sure. Well, we're in Marietta, Georgia, which is a little bedroom community just north of Atlanta. My practice is Marietta Facial Plastic Surgery, Laser and Aesthetic Center. You can go online and either put in MariettaFacialPlastics.com or SethYellen.com, and you'll find our website. Our office number is 770-425-7575, and we're here to serve you. So we're really hoping that at the end of the day, when I close my practice, I can think and say, you know what, I've really helped a lot of people feel great, and that's really what it's all about. It's that fulfillment, personal fulfillment that I get every day from my practice that makes coming to work so much fun.
That's wonderful. So, you know, I take a lot of joy in the ability to connect with people like this. Just read the internet news and look at all the people that they're talking about, and then compare them to these amazing people we have here, dedicating their lives to making others' lives better. So thank you so much for being you. Thank you for doing our interview, and thank you for watching. We're grateful for you. We appreciate you, and more videos coming soon. Bye-bye.